A few comments about telemedicine. Telemedicine has been around for a while now. It's growing. It's spreading into multiple different specialties and contexts because it scales medical providers. Medical providers are the scarcest commodity in healthcare, and telemedicine scales their skills, scales their ability over distances. So there's a lot of different applications for telemedicine. And in urgent care, though, it's low revenue. We already have the high fixed cost model with the bricks and mortar. And so it's really not a game changer for urgent care to do telemedicine kind of on the side. The only thing that makes any sense at all to me is load balancing. If you have slow clinics, that you can load balance and send those visits that direction for folks that are already being paid on, already because they're on duty at a clinic. So that makes sense. But other than that, it doesn't make a whole lot of sense. You would never want to take a provider at a busy clinic to take time out to do a telemedicine visit when there's other patients waiting at your urgent care site. So that makes no sense. But another comment I want to make about it is that while you might do it for load balancing, etc., there are companies and situations where insurance carriers even are getting into the telemedicine arena. I know one large carrier already has their own telemedicine platform. They are siphoning visits away from urgent care. Some of the simpler ones, folks calling up for, my sinus infections, back, sore throat, et cetera, et cetera. So they are siphoning off some simple urgent care visits that otherwise would come to your clinic. So it represents yet another kind of a caution about the future of urgent care. And to me, it underscores the need to be doing injury treatment. Injuries can't be treated over the phone. You can't do x-ray, can't sew lacerations, can't remove foreign bodies from the eye, can't treat fractures over the phone. So it's really important to continue to treat injuries. Do not refer those out. You need to really ace out injury care. Sports medicine, regular routine urgent care injuries, and worker comp injuries are very important. In fact, comparing to telemedicine, the x-ray alone in the injury context is worth more revenue than a telemedicine visit, and the x-ray doesn't require a provider to do it. So keep that in mind. I would encourage everybody, try to do injuries. So many of the providers now are not as experienced in injuries. They didn't have the benefit of a residency program. So I'd like to suggest OccDocOne as an alternative to help upgrade and teach and train, kind of make up for that missed residency. Over 300 guidelines, 400 videos, a lot of teaching in it, training, visit by visit guidance so they can take the case all the way through to completion. So give it some thought. I'd love to show it to you on a Zoom call. So sign up. Take care.